All right, let us begin a new question set to practice. My name is Harshal. This is Report Healthcare with Harshal. And this is a separative book, Radiology chapter, practice question set. You have four options in front of you. Get the best possible answer among the four options. A patient presents with a history of transient ischemic attacks. The physician orders a complete bilateral extracranial arterial duplex scan. Radiologist documents evaluation of the common carotid, internal carotid, external carotid, and vertebral arteries bilaterally using spectral and color Doppler analysis. All right, if you have not got the answer, please pause the video. I want to tell you the answer here. It's option A, 93880, as it is reported for a complete bilateral extracranial arterial duplex examination, and that's what exactly mentioned in the question as well. Moving on to next question. Patient undergoes an MRI of the abdomen without contrast due to persistent right upper quadrant pain. Following review of the initial images, the radiologist administers contrast and obtains additional images during the session. Get the best possible CPT code here. All right, answer to this question is option C, 74183, as it describes MRI of the abdomen. What we are exactly looking for by the question. Moving on to the next one, a physician orders a limited abdominal ultrasound to evaluate a known gallbladder polyp. The examination is restricted to the gallbladder and common bile duct. Get the best CPT code among the four options here. All right. The correct code for this question is option B, 76705, as it is used for limited abdominal ultrasound. Moving on to next one. A patient undergoes a diagnostic mammography of the left breast after an abnormally is detected on a prior screening examination. No imaging of the right breast is performed. Get the best CPT code among the four here. All right, correct answer to this question is option A, 77065, as it describes unilateral diagnostic mammography. Moving on to the next question, a radiologist provides only the interpretation and written report for a CT scan of the thorax with contrast. The hospital owns the equipment and bills the technical component separately. How should the radiologist report the survey? Should it take around 50 seconds for you to answer this question? It's very simple now. If you like what I'm doing, please like and subscribe to this channel as well, like to this video, and do let me know in the comment what else can be improved here. If you're looking for a particular content for your medical coding certification, or someone who is just a medical coding professional, if you're looking for something, you want to learn something, do let me know. I'll try, as I help medical coders. I don't claim anything otherwise. All right, if I've got the answer to this question, if not, pause the video. If I've got the answer to this question, the answer is obviously 26 modifier. So that's option B here. Moving on to the next question. A patient undergoes a complete pelvic ultrasound using a trans-abdominal approach. The uterus, endometrium, ovaries, adnexal regions, cul-de-sac are evaluated and documented. Which CPT code should be assigned here? All right, if I've got the answer to this question is option B, 76856, as it describes a complete non-obstetric pelvic ultrasound that is performed trans-abdominally. Moving on to the next question, a patient undergoes CT angiography for, of the lower extremities with contrast for evaluation of peripheral arterial disease. Three-dimensional post-processing is documented in the final report. Which CPT code should be reported here? All right, the right answer to this question is option B, 75635, as it reports CT angiography of the abdominal aorta and bilateral iliofemoral lower extremity. Moving on to last one, second question. A patient undergoes a complete breast ultrasound of the right breast. The report documents evaluation of all quadrants and a retroalveolar region. No imaging is performed on the left breast. Get the best CPT code among the four here. Also, if you have not liked, please like to the video and let me know in the comments what do you feel about the content. All right, the answer to this question, if you have not got it, please pause the video. The answer to this question is option A, 76641, as it reports a complete bilateral ultrasound examination. All right, towards the last question for this question set, a physician orders a CT scan of the abdomen and pelvis with contrast. I mean, even that line is enough for us. Line is enough for us to code a CPT code among the four here. All right. The answer to this last question, please do a drop a like and subscribe to this channel. The answer to this question is option B, 74177, as it is the code that is because we have selection is based on the service actually performed. So sync contrast was administered and post contrast imaging was obtained. 77 is appropriate here. All right, I'll see you in the next one. My name is Harshal, and let me know in the comments what exactly you're looking for in the next content or in the future. Thanks, and all the best medical coding the medical records. All right.